Welcome to Mental Health Care today. I'm Jim Szyperski, and we are so fortunate to have some wonderful guests today to speak to us, Nikki King and Lindsey Gessendorf. And theirs is a good and very powerful story of treating behavioral health and substance use in rural America. Nikki King is the manager of behavioral health and addiction at Margaret M.I.N.I Hospital in Batesville, Indiana. Lindsey Gessendorf is a licensed clinical social worker and clinical director of substance use services at Margaret M.I.N.I Health, and also the creator of the addiction and drug program at the Ripley County, Indiana Courthouse. For some quick background, I first came across Nikki about a year ago when I was reading through an MIT publication on their MIT technology, and it was really a tale of two cities. One about an addiction program that was being created in California that was raising millions of dollars through venture capital. And the other was really a story about Nikki and her team in rural America and what they were doing in their community and building in their community and serving their community. So it really was a very powerful story. I was so impressed by it. So with a little bit of background like that, I'm also, by the way, for those who haven't heard it, Nikki can be found on, she did a TV publication or a TV broadcast with Amanpour Company on top of that. And I would highly recommend both of those to anybody who is interested in finding that. Without further ado, Nikki, I know you grew up in Eastern Kentucky. You grew up in rural Appalachia. You went to University of Kentucky, and now you're in Indiana. And as someone who grew up in North Carolina, I feel like we should be talking basketball. But since this is probably not a very good year for any of those states, we can skip over that, I suppose.
That'd be for the best.
So can you tell me, can you maybe just start with you, Nikki and Lindsey, can you tell me a little about the work you're doing at Margaret Mary and some of the challenges, and maybe contrast those challenges of rural addiction treatment versus urban addiction treatment or urban substance disorder treatment? Because I perceive, at least from some of the things I've read, that there are some differences there.
Yeah, so I'll speak a little bit about Margaret Mary and our community, and then I'll turn it over to Lindsey to talk about her passion, which is substance use. So basically, yeah, we're part of Margaret Mary Health Center, which is a newly minted not-for-profit clinic. We are serving Batesville, Indiana, so it's a town of about 6,000 people, but we also serve a lot of the communities around Batesville, most of which are significantly more rural than Batesville itself. In fact, Lindsey is headquartered out of Brookville, Indiana, which is a lot smaller than Batesville. So our organization serves two entirely rural communities, Franklin and Ripley County, Indiana. For anybody who's familiar with that part of the world, we're about halfway between Cincinnati and Indianapolis. Batesville is known for Hill-Rom, which makes hospital beds, and also known for the Batesville Casket Company. I think like 70 to 80% of the caskets in the country are made here in Batesville. Our program's better than that would imply, but such as it is. So yeah, I'll turn it over to Lindsey to talk a little bit more about the specifics about substance abuse in rural communities.
So I will start with the fact that I'm from Ohio, Cincinnati, and so going into Indiana was much different than what I've seen in the past. If you go to Cincinnati, you can find treatment centers anywhere. You can find sober living housing anywhere. And that's not what I ran into when I started working in Indiana. And so the difference for me is, the level of trauma we're seeing it's skyrocket. And unfortunately, for so long, we took the stance of mental health and substance use existing in bubbles. We didn't put them together. And they exist together. So 80% of people with a substance use disorder have a co-occurring mental health diagnosis, and oftentimes it's going untreated. And when you're in Indiana and you're lacking access to psychiatrists and providers, you have this unique circumstance where you've got to find a way to make this work. This person is struggling with a substance use disorder. They've been incarcerated. They have PTSD. They also have an untreated bipolar disorder, that we have to treat all of those things to make this person successful. And for so long, all these programs came out and they would treat one. So they would say, you can't come into our substance use clinic if you have a major mental health diagnosis. Okay, well, you just got rid of 80% of people with a substance use disorder. And so we took a different approach. These things don't exist in a vacuum. We're going to treat your substance use disorder, your mental health disorder, your trauma, the factors in your life that are making it difficult for you to maintain sobriety. Because if we want to be successful and we want to be a top of the line program, I can't just treat you like you exist in a vacuum. And so we took limited resources, and with Nikki's amazing grant writing skills and our team's dedication to working nonstop, we've been able to treat the whole person. And to me, it's amazing because what we're seeing is patients that have been through 6, 7, 8 treatment programs, have been incarcerated multiple times, spent years in prison, and they're coming out and they're able to have successful lives. And so I'm just amazed with what we're able to do with limited resources and really give these people the help that they need.
I mean, that is so interesting because our chief medical officer, who also serves as a medical director for a substance use disorder clinic in Boise, Idaho, has a comment, and you just hit it on the head. He said, everybody has a secondary diagnosis who comes into our place. You know, we tend to think of it in terms of substance use disorder, but in fact, there is generally some underlying cause, whether it's PTSD or it's ADHD or something underlying. And then really, until we can get to that, we really can't get to the heart of the problem. So it's wonderful to hear you say that, Lindsey. That's confirming for me after having heard that a number of times over the past several years. You know, Nikki, when I first reached out to you, we were talking about the pandemic and the impact of the pandemic a little bit just in our messaging. And you had a quote, and I pulled it out: the pandemic has unleashed Pandora's box of mental health issues, and it's hard to keep up. So maybe, you know, would you address that first, Lindsey? Then I'd love to get Nikki's view on that as well. I mean, the impact of that. I mean, we see it everywhere, but I'd love to see how you're seeing it in your community.
When you said pandemic, my eyes lit up because it's been such a difficult challenge. People are isolated. And so, one of the biggest things I think we've seen is domestic violence has skyrocketed. We have had patients lose friends to domestic violence through this pandemic. When you create this sense of isolation, lack of access to services, you're setting people up to have significant mental health struggles. And so you have somebody with depression that you're saying, okay, for the next year, you can't really leave your house. You can't see your family. You're already on probation. You're already on house arrest. Now your NA and your AA is gone. All in-person services are disconnected. And so the overdose rate is skyrocketing. The relapse rate is skyrocketing because people can't exist alone. We're social. We're meant to be together. And addiction in and of itself is a very isolating, secretive illness. And so is PTSD. And then you add the ability to take away all in-person access, and you've created this perfect cocktail of severe mental illness.
Just as a follow-up to that, how are you able to treat them? Are you able to do phone support or any type of video or telehealth capabilities, or how are you handling it?
Absolutely. So we're doing telehealth. We also have myself and our peer recovery coach have a work phone on us 24/7. Patients have access to us. That doesn't necessarily mean they're going to get a hold of us right away, but we'll respond to them even on the weekends. We're doing in-person one-on-one sessions, so we're offering that more frequently to people. We're trying to utilize the resources we have. We're currently connected with probation, so one of the things we've asked is increase in home visits. And so any contact you can get with somebody face-to-face, because unfortunately, you can see me on a computer and I might present very well, but you don't know what's going on in my life when you can't access my body language. You can't see the day-to-day things that have fallen apart because of the isolation. But we're doing our best to make sure they have access to services, even if it is virtually right now.
Interesting. Nikki, and maybe to that, addressing kind of that same issue, what has that done to the resources you've had available? Because I imagine that puts incredible strain on the people, the dollars, the funds that you have to support these programs. Maybe you could talk to that for a second.
We've seen our referrals go up 200%. I'm going to be honest with you. Everybody is at their breaking point. Everybody in healthcare is at their breaking point. I mean, that, you know, when you talk about that, you talk about a lot of the acute care workers who, you know, they were putting themselves directly in harm's way, their family in harm's way for months to take care of people who, you know, were coronavirus positive, people who were volunteering to work in, you know, conjunction with those patients that normally wouldn't be in those settings. And then, you know, you kind of have mental health who's over here just sort of quietly plodding along, you know, and it's not the same kind of risk as, you know, like the people who work in med surge and the people who work in ICU and things like that. But there's almost a secondhand trauma. So it's almost like a survivor's guilt because you're not up there working directly with it. And then on top of that, then you get hit with the backwash of, you know, these just huge numbers of patients and you know, and I think that people forget that, you know, healthcare providers are people too. We're struggling with the same things everybody else is in the pandemic. And on top of that, our jobs have now been made exponentially harder and there's no end in sight. You know, I think every week, Lindsay will laugh. Every week I try to give a little bit of hope. Oh, maybe we'll get another provider, or maybe it'll slow down, or the vaccines, you know, look at our vaccine rate. And then every week we get more and more referrals. And so it's like, nope, no, it's just more dirt. Just keep shoveling. It's great. At this point, it's easier to just dig down than it is to dig up.
You know, you bring up a really good point. You know, there's one of my favorite phrases that I stole from someone who's a doctor out west one time was, mental health care is healthcare.